Okay, today we're going to demonstrate how to insert a straight catheter into a male bladder for a urine specimen. And so I have my doctor's orders here according to CG Wipes. I'm going to check my orders. It says do a straight catheterization for a urine sample on Robert Hoffel. So I'll gather my equipment. I need a straight cath kit. I have a pair of extra sterile gloves just in case I need them. My biohazard bag because I'm doing a urine specimen. And then a regular garbage bag for all my garbage supplies while I do my procedure, and a Chuck's pad to keep the bed dry. Okay, so let's go see Mr. Hoffel. Hello, Mr. Hoffel. My name is Patty. I'll be your nurse for today. Your doctor has ordered that I put a catheter into your bladder to get a sterile specimen. So we're going to do that procedure now, okay? So I'm going to wash my hands. Can you tell me your name? Robert Hoffel. And I look at his ID band, Robert Hoffel, 47892, room 252. Okay, do you have any allergies, sir? And he has none, and his allergy band says none. So now I'm going to provide for privacy. I would pull the curtain. I will leave that open so that you can see the filming. And I've already explained my procedure. And so now we will elevate the bed for safety and for my body mechanics. And I'm going to raise your bed, sir. And we're going to wash you up down there so that you're nice and clean and comfortable. This protects my back as well as keeps a sterile field by keeping it at waist level. Yeah, I can put the side rail down if I need to. I'm not sure at this point that I will need to, but I'll fan fold the covers. And then I'm going to place him supine with his legs abducted. Pull those legs apart a little bit, and I could use a bath blanket to cover him. We're not going to do that today, but I will use clean gloves to do peri-care. I think I would want to place the Chucks first, so I think we'll place that Chucks first. Mr. Hoffel, can you lift your hips for me? He's not real good at that. Okay, so my patient is in the proper position, hips abducted, and I'm going to do peri-care on him. And the only thing that I need to pay attention to here is that I retract the foreskin. So we're going to pull the foreskin back so that we can cleanse around this real good. And then we're good to go. I'm going to remove these gloves because they're contaminated and pitch them. Okay, now I'm going to set up my sterile field. This will be my specimen bag, and I want to open it so I can get that specimen in here pretty easily. This is my garbage bag. Remember that when you're throwing things away from the client that are going into his body, they may not be free of contamination, so you don't want to put them in a regular garbage bag. But I'm going to use some more hand sanitizer. I have a pair of sterile gloves here if I need them, but I think there's a pair in my bag. So we're going to open the kit. I read the directions, it would be easier. Okay. I like to have my sleeves up. Just doesn't want to come out today. There we go. Okay, I'm going to throw that away. I've got my kit here. So I always open away. Side to side. And then the last one toward me. And still hold on my 1-inch borders. Okay, I'm looking for a corner here. Lift this up. This is the drape that will go on the bed. The waterproof side is on the bottom. Alrighty, I'm going to grab my gloves. I do have sterile gloves here, so I don't need these. I can put them in my pocket. I could do this at the end of the table, or I can do it just right here. I think I'll do it right here. I'll have more room. I have a 1-inch border, so I can open that up. I don't want it to cross over my other sterile field there. If that glove had fallen within the 1-inch border, I would have had to pitch it. But I think we're okay. So there's the first glove. Now, this glove is completely sterile, so I can fix it and lay it the way that I need it. Get under that cuff. And the thumb goes out. Alrighty, 2 gloves. Now, sterile and I can touch. So my fenestrated drape goes on. My lube in there, take my specimen piece out, take my lid out, I might want to see that lid. Okay, I'm going to open up my iodine and put it on my cotton balls. I'll open up my lube and I'll do 7 to 9 inches, or 5 to 7 inches, I think it is. Alrighty. Then I think I'm ready to move down to the bed. Alrighty, I'm going to pick up my forceps. I'm going to grab his penis and I'm going to lift it slightly. That's probably a little close. From the meatus, I'm going to go around cleaning the whole glands, starting at the meatus, cleaning the whole glands. Okay, 3 is sufficient. You can do more than that if you want. Throw away my forceps. I could take this over, but I don't want to cross my lid. Okay. Move this whole system up. This is my specimen container. I want it close. And I'm going to grab my catheter, and I'm probably going to need some lube. Okay, so holding his penis up erect, I'm going to insert it. I'm going for 7 to 9 inches straight down. I'm going to ask the patient to take a deep breath. That causes him to relax. If I have any trouble going down there, I might ask him to take another deep breath. I would drop the penis, maybe twist the catheter, lift it back up, and try again. If I still can't get it in, I'm going to withdraw and just call the doctor. But at 7 to 9 inches, I should see urine, and so I'm going to clamp it off and grab it here, put it in the container, and then release it. Get my specimen, then clamp it off again, put it in the larger container while I get my specimen out of here. And then some people like to cap it right now, others like to wait. You can do either way. Okay, I'm releasing the grasp on my catheter so that the urine flows, draining, but I have not let go of the catheter. This is important because if you let it go, it could come out with the urine. So you want to hold it in place. Fill your container. When the urine stops flowing, you can pull it out. But at this point, I'm going to assess the urine for amount, color, clarity, and odor. And when it's complete, I will pull the catheter out. I can throw it away in my bag here. I'm going to remove this container of urine over to my bedside. Careful not to go over. If my cap was still laying here, I wouldn't want to go over it. I'm going to clean my patient up a little bit. I may grab this washcloth that we used before or an extra one and do post-procedural care, cleaning off that betadine so it doesn't dry out the skin. I'm going to replace the foreskin. And then I can get rid of this towel. I'm going to remove my gloves. Put on clean gloves. Rid of my garbage. Get rid of my chucks here. So that I can cover my patient up. Okay, Mr. Hoffel, you're all done. Put him down in a comfortable position. You can move his legs back together for him. Alrighty, now I'm going to deal with my specimen. Clean gloves because it is still biohazard. I'm going to label this specimen, so I have a sticker in here somewhere. Name, room number, date, all this information. I'm going to fill it out, put it on my specimen, put that in my specimen container bag, my biohazard bag, and then this goes down to the lab. Then I can take my urine and dispose of it properly and record the amount, color, and odor as well as the volume. I would measure this. When all that is done, I can pitch all of this, and then I would wash my hands and document. So I'm going to take these off, I'm going to wash my hands, and then I'm going to document. I'm going to document the date and the time, the procedure that was done, and the patient's tolerance, the amount, color, odor, and clarity of the urine, and that a specimen was sent to the lab.